guys, welcome back. We're going to look at some vitals. I like to break my vitals up into 3 different categories. I like to break them up into blood, air, and brain. We're going to start by looking at blood. The first vital we're going to look for related to blood is going to be our heart rate. When we look at our heart rate, we're going to look at 3 different things with it. Our rate, our rhythm, and our quality. RRQ, rate, rhythm, quality. Our rate is going to be measured in beats per minute. So, when we take that pulse, wherever we take it, we're going to count it out for 30 seconds and multiply that number by 2. That gives us our beats per minute. That's our rate. For our rhythm, we're going to feel that pulse and feel the rhythm of the pulse. For most pulses, it will be consistent. We're going to have a bump, 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 bump. That's going to be regular. If we have an irregular pulse, we don't have that consistent regularity to it. There's a lot of different irregularities in there, so look for that irregularity. For our quality, we can have a weak and thready pulse where it feels like somebody has a piece of thread that's just popping through the skin. You can barely feel that pulse. Or you can have a big bounding pulse where you feel that pulse and the vessel feels like it's going to bust through the skin. Anybody think of what that would be indicative of? We'll cover that a little bit further. All right, so that's our blood with our heart rate. What else do we have on blood? Blood pressure. So, for those pulses that we felt over here, with our quality being bounding or weak and thready, that's going to kind of come down in here and tie into our blood pressure. That high blood pressure, we're going to feel that bounding pulse. For that weak blood pressure, we're going to feel our weak, thready pulse, blood pressure. We're going to look at skin signs. So our skin, color, temperature, and moisture. Where do we feel for someone's skin? We're typically going to feel on the core, 2 fingers, right on the chest, the back of your fingers on the chest. We don't want to feel for temperature on the hands because most extremities are going to run cold. We do forehead or the core temperature is going to give us our truest temperature. So, our skin color, we're looking for pink, dark, gray, ashen, what color our skin is. Just that touch temperature, is it hot, is it cold, and our moisture. So, diaphoretic or sweaty, clammy, dry, our skin color, temperature, moisture. We're going to have temperature as its own category. Our temperature is up here, but down here we're going to get a numerical value for our temperature for this vital. We also get to throw in a CBG. Anybody know what CBG stands for? It's going to be our capillary blood glucose. So this is going to be how much sugar is floating around in our blood. And then we've got one more, it's going to be CMS. We'll go over this vital a lot when we do our backboarding or our splinting station. This is going to be circulation, motion, and sensation. We'll cover this more in detail later. Our blood, our air. So for our air, we're going to look at our respiratory rate. Our respirations, and we'll still look at, let's do respirations. And again, we're going to look at our rate, our rhythm, and our quality. So our rate, we're going to measure in beats per minute. We're going to count for 30 seconds and multiply by 2. I'll tell you, this is the one time you get to kind of fib to your patient, because we can't tell them that we're going to watch their breathing to get their breath. Because if we tell our patient, all right, I'm going to check your respirations now, they're going to control or change their respirations. So a lot of times we can take that radial pulse and put it across their chest. And while we tell them we're taking their pulse, we're also looking for that rise and fall of the chest, or we're able to feel the rise and fall of their chest. While we count for 30 seconds, multiply that by 2, and that gives us our respirations per minute. Our rhythm, again, is going to be, is it a regular rhythm, or is it going to be irregular? Fast, fast, slow, or slow, slow, fast? What's the regularity of it? Our quality for our respirations is going to be fast, shallow, deep, labored. Those all describe our quality for respirations. Another vital we have related to air is going to be our lung sounds. We'll go over later where we take those lung sounds, but our lung sounds can be clear, they can be unequal, where we have wet lung sounds on one side or diminished lung sounds on one side, but everything's fine on the other. We can have bronchi, not striders, more in your upper airway, in your throat, or bronchi, crackles, rales. Those are all things we'll have with our lung sounds. All right. We also have our oxygen saturation, or our SpO2. If you guys have already watched our videos on supraglottic or BBM, you saw that we checked our SpO2. That's where one place that we can use this vital. And then we'll also have our EtCO2. That's going to be our end tidal CO2. That's going to measure our end tidal, so the end of our ventilation or respiration where the air comes out, the amount of CO2 in our air. If you guys have already watched our videos on supraglottic airway or BBM, you notice that we checked our end tidal CO2 there. So that's our blood, our air, and then we're going to have a couple more for our brain. One vital we have in our brain is going to be our level of consciousness, or LOC. We'll go over more about our LOC on our AVPU scale. We'll also have our PEARL. That's going to stand for pupils equal and round, reactive to light. Another R in there for you. So we're going to look at our pupils to see if they're equal. One's larger than the other, one's smaller than the other. If they both react to light. And then we also, under brain, have something we call GCS, or our Glasgow Coma Scale. And we'll go over that further in another lecture.
All right, so we went over a general category of all of our vitals. Right now we're going to start talking about specific vitals. First thing we're going to talk about is a heart rate. So typically, if you have a patient that is conscious, the most efficient way and less invasive way for your patient is to go ahead and go for a radial pulse. Radial pulse is found on the outside of the wrist, or some people like to say it's on the thumb side or the rad side for radial. So if you grab right here, find this bone, just kind of roll into that groove, and that's where your radial pulse can be found. And we want to measure the radial pulse for 30 seconds, all right? And we're going to multiply it by 2. It's also nice to just kind of rest it on your patient's chest right here, and what you can also do without telling them is get a respiratory rate at the same time. So what I'm going to do is count the pulse for 30 seconds, and then I'm going to count the respiratory rate for 30 seconds, and we'll get our numbers from that. So I'll go ahead and start that. All right, so now that we've done our respiratory rate and our heart rate, what we're going to want to do is our skin color, temperature, moisture. Remember from our earlier demo, we want to try to go towards the core temperature. We're looking for core temperatures, feeling whether or not you're looking for diaphoretic, whether or not they're warm, whether or not they're cool. If you have somebody that has a little more difficulty in telling whether or not they're pale or they're cool, you can also check mucous membranes. You can check inside their eyes. You can also check inside their lips. You can also check nail beds to make sure that their skin color, temperature, moisture is where it needs to be. Next vital that we can go for is our lung sounds. Obviously, you're going to need a stethoscope to do that. I like to go to my patient's back first. It's a little less intrusive to them. So you can come into your patient's back and we're going to go for 4 different areas. We're wanting to see the top of the lungs. We're also going to want to see or listen to the lower parts of the lungs. And make sure you get low because the lungs go pretty far down on the posterior side of your patient. So when you're doing your lung sounds, when you're looking at your stethoscope, they point one direction. Make sure that the stethoscope points towards the front of your ears, just like your ear canals are. You want to talk to your patient. Sir, I'm going to take your lung sounds. I want you to take some nice deep breaths for me, okay? Take a nice deep breath. And it's nice to check your lung sounds left and then right to make sure that you're checking to make sure that they're equal and bilateral. So when you do equal bilateral on the top, you can then do equal bilateral on the bottom as well. After you get done with the posterior side, you can also move to the anterior side. We're going to do 4 lung sounds here. We're going to go on the top, and then we're going to go down towards the bottom a little bit to the side. Nice deep breath for me. All right, so his lung sounds are equal and bilateral in all fields. Another important vital that we want to get is our pupillary response. We're looking to make sure that our pupils are equal, round, and reactive to light. So we want a pen light, and typically what I ask a patient to do is go ahead and look at my nose right here, and as I shine a light in their eye, I'm making sure that not only does that eye react, but the other eye at the same time. I'm making sure that the eyes are the same diameter. I'm making sure that they react at the same amount, and I'm looking to make sure that they're both either pinpoint or dilated.